We know that primary tumors and their metastases can change over time. We didn't appreciate it as much in the past because we only had limited ways of looking at it. We'd look at proteins, we'd look at large segments of DNA deletions, and for the most part, the tumor and the metastases seemed about equivalent, and when you look across the tumor within a large tumor, it all seemed clonal. We used to just think of cancers as a bunch of clonal cells, a bunch of carbon copies. But now that we've got more discriminating techniques where we can do whole genome sequencing and protein arrays and RNA arrays, we are finding that there's actually what we call intratumoral heterogeneity. So within a tumor itself, you'll see variations in how proteins are expressed and also how the pathways are activated. And it sort of makes sense when you think about what a tumor is. It's a micro-ecosystem. It's a bunch of cells that are vying to survive. They're competing for resources, for food, for energy. So it's survival of the fittest. So if there happens to be, say, a new mutation in one of a million cells that gives it a growth advantage, that particular area of the tumor may continue to grow with its new genetic change and ultimately take over the tumor. And we're starting to see this in many disease types, leukemia, myeloma, and breast cancer, that the populations of different clones change over time depending on treatment. And we've known for years, but never been able to fully explain, that sometimes when a patient has a metastasis, if we get a biopsy of the metastasis and stain it, which in the past we didn't do very often, that about 10% of the time the estrogen receptor was discordant, and same for HER2. So, and that actually changes management. So it has now become routine practice and in the guidelines that whenever feasible, when it's felt to be safe and feasible, that we do obtain a biopsy of a metastasis. Number one, to confirm that it's cancer and maybe not a new primary, like a new primary lung cancer, but also to recheck the biomarkers.